next few minutes and then please do introduce yourself in the chat. We'd love to see and hear who is here joining us today. I see some familiar names and faces, so welcome back. And yeah, so please introduce yourself, what brought you here today. And as always, we are open to questions and feedback, so use that chat function and make sure you put in your questions throughout. But hold on and we'll get started in just a couple minutes. Right, so I see more and more people joining, which is great. And we'll give folks another minute or so and then we'll get started. I think we've got a lot to discuss today and want to make sure that we save some time for questions. And so we'll get started here just in a minute. For those who just joined, if you'd like to introduce yourself in the chat, we'd love to see who's here. And there's people coming in every second. I see some more familiar names, so welcome back. And to those who have not been on one of our forums before, welcome. I'll go through just sort of the format and introduce our speakers here in just a minute.
I am Shirley Dabney Williams.
Hi, Shirley, welcome. Thank you for joining us.
Thank you.
Okay, so we are just a couple minutes past the hour, so I think we'll go ahead and get started. Again, to those of you who just joined, please do introduce yourself in the chat. We would love to see where you're coming from, what brought you here today. And with that, we will get started. So I'm Allison Fiscalini. I'm the director of the Athena Breast Health Network and the Wisdom Study based here at UCSF. We host these Wisdom Study community forums every month, the last Monday of the month at 4 o'clock Pacific time. These are open to everyone and anyone who would love to join and just be part of a discussion around new learnings and key topics in women's health and specifically in breast cancer and risk assessment. And we sort of tie everything back to how we are trying to improve the field with the Wisdom Study, which is our ongoing research study across the country. We have recently expanded the study to enroll younger women starting at age of 30. And we'll go through some of the key items within that risk assessment that we're providing as part of the study now. So welcome, everyone. So the session format is that we do want to hear from people on this call, that we want this to be a discussion. We want to hear where you have questions. If something wasn't clear, please feel free to enter a message in the chat or raise your hand. You can submit your questions in the chat and we can either answer them if they're timely to the discussion or wait until the end, but we do want to have some time at the end so that everyone gets a chance to ask those questions. We do ask that if you're not speaking, if you could mute yourself, and that just helps so that our speakers can be heard clearly by others. And we are recording the meeting. We do share this on our YouTube channel as a resource for people who weren't able to join. And at the very end, we'll send out a short post-meeting survey that we hope you'll fill out and give us some feedback on how the session was and suggestions for future sessions as well. So The point of these community forums really is to move together toward equity and better outcomes in breast cancer for everyone. We started these forums, gosh, it may be 3+ years ago, and have been doing these monthly ever since. We have a huge library of topics that we've presented on in the past that are on our YouTube channel, and we can share the link in the chat to that channel where you can look back and refer to those as resources. These are also topics that we're happy to revisit. The science and the evidence is always changing, and so if things come out from other studies, we always try and update the group so that you guys are informed and we can share results and have discussions about results that may be coming out if they impact your own decisions and your own healthcare as well. So for this month, we are talking about our recent expansion to Color's Hereditary cancer test, which is a change to what we've been doing over the past 8 years or so with the Wisdom study. And so today we will highlight sort of what our progress has been to date with participants who may be joining soon or have recently joined. So with that, we are excited to have this discussion today. I'll do a couple quick introductions, and then I'm going to pass the ball off to our two guest speakers today. So I'm going to start with Kathy Ross, who is a Wisdom breast health specialist and also a genetic counselor based at the UCSF Cancer Genetics and Prevention Program. And in her role at UCSF, she helps patients with a personal or family history of cancer to investigate whether their condition is hereditary and helps them in learning about their cancer risk and next steps. And as part of our breast health specialist team, she does active outreach consultations mostly to women who we find to have a genetic mutation in one of the breast cancer genes. But she's also part of our scientific team and part of our screening review board and our risk thresholds team, sort of the behind the scenes of how all of our risk assessments happen on the Wisdom study. So welcome to Kathy, and she'll speak first. I'll introduce Kelly quickly as well. So Kelly Tangney is joining us from Color Health, where she is a senior manager of genetic counseling services and lead genetic counselor for the NIH All of Us research program, genetic counseling resource. And she has over a decade of both clinical and research genetic counseling and management, and also working with implementation of numerous study. And so we'll go through today sort of where we've been and where we're hoping to go next with the testing that we're using in the context of the Wisdom study. So with that, I will pass it off to Kathy and we'll go from there.
Great.
Wow. Wonderful. Thank you all so much, and such a wonderful introduction. I'm fortunate to be the breast health specialist that gets to talk with many of our participants when we do identify a known hereditary risk factor. So that's a big part of what I do. And as part of that assessment, all of our breast and chest health specialists consider the family history, breast biopsy history, breast density, age, and lifestyle factors, as well as a wide variety of hormonal and environmental exposures and reproductive and biological factors. We know our genetics play a role for 5 to 10% of cancers, and for those participants that I speak with, it may be a significant impact on their cancer risk. So we try and walk them through that process and connect them to resources outside of the study. As a 5-year plus study going into its next 5-year long study, the Wisdom study has been doing this for quite a long time, and we're very fortunate to have learn some lessons along the way and to had the opportunity to build and adapt our level of testing as the technology has become available. Initially, for some of you early participants from years 2016 to 2023, we know the testing being offered as part of the Wisdom study was pretty narrow focus and only covered 9 breast cancer genes using analyses looking at small single and letter changes or single nucleotide polymorphisms from our genetic code and using that small list of SNPs to try and extrapolate beyond just the larger mutations that the 9 gene panel looks at. And then more recently, in this last year, we have updated the testing technologies that Color was using and that Wisdom was using through them for beyond just looking at a limited number of SNPs. We now use low coverage whole genome sequencing, which is a lot of words to say that we look at not just specific locations within the genome, but we read the whole genome at a lower depth to try and cover and look at even more risk factors than what had previously been analyzed. And now moving forward, we're very excited to update you all that in October moving forward, we'll be analyzing 29 different genes associated not just with breast cancer, though 12 of those genes will be covering breast cancer risks, but across a variety of breast and other cancer disease sites. This is hopefully going to help cover more family history and help identify more individuals who have risk factors that may be relevant for your screening or other risk reduction management decisions. And it'll continue to be solidified through the low coverage whole genome sequencing backbone. So we're going to be considering many, many more risk factors than we've ever been able to consider before that implementation. And I'm so grateful to be coming up and you'll be hearing from the wisdom of the Color team shortly on some of those specifics.
Excellent. And just as a little more context, as Kathy was mentioning, the change from the single nucleotide polymorphisms, those limited SNP panel, we had just over 300 of those SNPs. And with the low coverage whole genome sequencing, we have about 10 million. And so you can think about that as like a library of information that as new studies come out, there may be other pieces of that 10 million library that we can draw upon instead of just being limited by that panel. So it's a big opportunity for us to continuously improve and learn from the existing data without having to go back and retest people. So that's a big opportunity that we have here in the Wisdom study with the low coverage whole genome sequencing. But I will pass the ball off to Kelly because what she will focus on is the hereditary cancer panel and explain what that panel covers, what the process is, and we'll do a little demo so that you can get a sneak peek of what that looks like. So I will stop sharing and pass it over to Kelly.
Hi, everyone. Thanks for having me today. Coming from Color, I am Kelly Tangney. As mentioned, I'm a genetic counselor and cancer risk expert at Color, and have worked with the Wisdom staff for quite a number of years. So excited to talk a little bit more about this expansion today. I will go ahead and share my screen here. All right. So we know that, as Kathy had mentioned, there are many factors when it comes to the development of cancer. One kind of smaller piece of the pie is that there are some hereditary genetic factors that we know of and can identify. And that when we do find one of those hereditary components, there are guidelines we can follow that are very clear on what screening and management may be appropriate for patients with that known identified genetic component. And so that's really what we're trying to assess here at Color by doing the genetic screening. But we also know that a bigger piece of the pie when it comes to which cancers develop are due to other factors. So they can be, the majority of cancers are just sporadic due to a combination of factors like normal aging process, how we treat our bodies, what we're exposed to over time. And also, there is a portion of cancers that are what we call familial, meaning we did not necessarily find a genetic component, but there's more cancer in the family than we would expect. And so that's where Kathy and others, other providers can come into play in deciding what screening is right for someone. But when it comes to kind of the color partnership here with Wisdom, we're talking about trying to identify these hereditary cancer genetic mutations or changes in the DNA that could impact someone's cancer risk. So why is it important to know if someone does have one of these hereditary cancer risk factors? Well, we know that in the general population, breast, ovarian, colorectal, and many other cancers develop in individuals without a genetic component. But when we do identify, let's take, for example, a higher risk gene like BRCA1, or we'll talk a little bit more about Lynch syndrome genes, which are related to a high risk for colon cancer. It greatly increases someone's chance of developing cancers. And so we want to identify this because we can enact in someone's cancer screening plan earlier cancer screening or different modes of cancer screening that might be more effective for high-risk populations. And the goal there is to find cancers at a really early treatable stage. And when we find cancers at an early treatable stage, we know that there is a much higher likelihood in a 5-year survival rate than when we identify them at an advanced stage. So it's really important to detect cancers early or try to reduce risk so that someone has less of a chance of developing those. So by identifying genetic factors, we can have a greater chance of accomplishing those two goals. So as Kathy mentioned previously, Wisdom had run a 9-gene cancer panel through Color Health, and we tested for these 9 really well-known cancer genes that are all related to breast and other cancer types. And each of these BRCA1 or PALB2 genes have a much higher risk for breast cancer. And so by knowing someone's gene results, we can then identify where they fall within this spectrum and what screening or treatment might be appropriate. Coming this month, we are going to be launching this new expanded hereditary cancer genetic panel of 29 genes. And you'll see, in addition to all these genes in purple, there are many others that we will now be able to test for and identify. And do not worry, you don't have to memorize or think about these gene names. They're all kind of a combination of letters and numbers. But they are all important to look at because they do, if you have a change or a actionable variant in one of these, do cause an increased risk for one or more cancers. For instance, I had mentioned Lynch syndrome. Lynch syndrome is actually one of the more common hereditary cancer conditions that can increase a person's chance of developing colon. A lot of GI cancers are related to these genes, as well as ovarian and uterine cancers in females. Additionally, we're testing for a few other breast and ovarian cancer risk genes, and some related to melanoma, which is a type of skin cancer, and some other less common genes, but that can pick up some additional colorectal and GI cancer risk as well. So we're really looking at a much more comprehensive cancer gene panel. And you can see here, this table is on the Color website as well. I know it's very small, but you can see here that for these 29 genes, they are all associated with one or more cancer types. And so it's very important to kind of assess these additional cancer genes when looking at someone's full genetic risk factors for cancer. So these are the main common cancers that are associated with these genes listed here. So why is a broader genetic test potentially better? We know that in addition to finding those additional cancer risk factors from our study of patients and participants, that there are actually a lot of other genetic variants to be found in other genes outside of those 9 breast cancer genes that were previously detected. And so by finding these other genetic factors, again, we can just increase the chances that we're getting the right screening and prevention for individuals. In this study, we do know that, previously in the past, not through wisdom, but even farther back in time, we used to test for just 2 cancer genes that were related to breast cancer, BRCA1 and 2, which are maybe the most famous amongst these genes. But when we ran this study, we found that a good chunk, almost a third of these cancer gene mutations were not in those 2 genes. And so we're really identifying more people with a potential genetic risk that we can help. So now on to kind of what this looks like. What would this experience be like to take a color test? When you claim one of these color genetic tests via Wisdom, you'll go online and complete a health survey. I'll show you what that looks like. But it's pretty simple from there. You provide us with a little bit of your information that we need to get the kit to you. Once that kit arrives to your home, you would submit the saliva sample and mail the kit back to Color using the prepaid shipping label that's on the back of the kit. Then we would then deliver those results to you through our online portal. And you would also have access to our board certified team of genetic counselors to discuss those results, discuss next steps, in addition to Wisdom team members like Kathy, who can really put the full picture of your genetic results together with other factors that Wisdom assesses. From there, we really encourage individuals to share their genetic results with their doctors and providers, who can help build a more personalized cancer action plan with other non-genetic factors too. And Wisdom also helps with that. And then we know that over time, our DNA does not change necessarily, but sometimes our scientific information and background on genetic information or risks or screening guidelines associated with what genes are being looked at may change over time. And so we at Color are committed to kind of updating all of our patients and participants that do submit testing so that we're able to get you the most up-to-date information over time. So we'll stay in touch.
So can I ask a question? So
Sure.
I'm really trying to reduce the redundancy that people have, because we of course have our health questionnaire that we ask people for. Is there a way, I presume that you're not asking anything different than what we are asking? Is there a way that we can share that to so people don't have to do it twice? Because that seems not fair.
Yeah, good question. So our health history form is completely optional. You do not have to fill it out, or you can fill some of it out as much as you know for things like your family history, your personal history. It does help us understand sometimes if a genetic change could be actionable in that what we call pathogenic or likely pathogenic range versus not over time. So we do encourage people to fill it out.
Well, except, so I would encourage us to try and find a way to share. Because
Yes.
it's not fair to make people keep filling stuff out over and over again. And we're partnering on this. And so I think it's really important for us to find a way to say, share my information from Wisdom or something like that, that we could, I mean, it's 2024. We should be able to figure that out. I mean, there should be some way that we can securely do that. So
Yes.
people don't have to repeat it. I mean,
Sure.
that's the whole point. We're partnering on this, right? So.
Yes, definitely something we can kind of talk amongst our engineering team on how that would work and API sharing and things like that. Yeah. Great. So on the Wisdom color kind of landing page here, when you get here, you would, if you wanted to take this test, you can see some more information about it. Scroll through some of that information as well as how it would work. There's some step-by-step instructions there. And you can see that there are some digital tools like sharing your results. And then when you're ready to actually claim your kit, you can click that Claim Your Kit. You would create an online color account and create your own secure information and password. Once you have set up your account, you would just answer a few questions that are necessary. There are some that are necessary to complete that help us understand if you're a good candidate for saliva-based genetic testing. We do not want to run a test on anyone that we wouldn't provide valid results for. And then once you are ready and fill out your, confirm your shipping address, the kit will be on its way, and you'll see that tracking information via email and on your dashboard. So that's kind of what the color dashboard looks like, and you'll be able to log in and view where your kit is on its way, where your results are in process, things like that.
And just to point out, for those who have been in the study and you did the genetic testing in the past, so the change that's you might have noticed is that instead of us shipping the kit to you directly, you go now to the Color website to create your own account and claim your kit. So just a small change, but we're really hoping that helps people complete the kit, knowing that they're the ones going to claim it and that they are sort of in charge of claiming it and ordering it, that type of thing. So that's just a slight change to point out. And also, everything is still for the Wisdom study at no cost. So even though this workflow is slightly changing and you're going in to claim the kit, there's no cost or exchange of resources. It's all part of the study still.
Yeah, I'll be interested to know if there's something that you think we should let people know. I mean, we were thinking about having a little short video too to explain to people, that we're changing the process, the process is to try and make sure that we don't waste any of the kits and that people actually claim them and they know that they're coming. And but you can share your information so you don't have to fill it out twice. You can, or like just certain things that we should say, that this is free to you as part of the Wisdom study. Susan, what was your question?
Could you get to the Color website through the Wisdom site? So what we do on our end is everyone who is eligible to get a color kit, so everyone in the personalized arm of the study, we send over to Color and they upload them into their system. And then we notify all of our participants who are eligible to go to the Wisdom website. So we link to it in an email that we'll send you, along with some instructions on how to go claim your kit on the Color side. So there will be an email that you'll get with a link that will take you to how you can claim your kit. And because Color has the list of people who we've placed an order for, only those who are we've sent their contact information over for so that they can create an account, will be able to. So it's sort of a way to limit who's going through this URL or this website. It's only those people who we've placed an order for. Yeah.
Is this a video to show how to use it, or?
Yep. So once you do claim your kit, you can choose to answer that optional genetics health history question. When your results are ready, I'll just back up just a second here. When your results are ready, you can view them online or schedule a phone visit with a color genetic counselor to review your results. Again, these phone visits are free to you as part of taking the color test. And you can schedule them pretty seamlessly online or by giving us a call, and we'd be happy to schedule on your behalf. You can choose your time zone, your preferred language, and then what date and time works best for you. And the benefit here is that you can talk to a genetic counselor, genetics expert that will go over the results with you via phone, and you can have them pulled up on your mobile phone or computer or tablet while we're going over them if you'd like, so you can see what those look like while we're discussing them and what they mean for you and your family. So what's included in color genetic counseling? We do a pretty in-depth review of the results, how we came to find those, what risks might be associated with genetic changes that we find, again, implications for your cancer screening, prevention, treatment, as well as what that might mean for some of your relatives, since these are hereditary genetic components. They can be passed down to through generations, and so other family members may have a chance of having this as well. And so we can talk through how to share those results and what that might mean for them. We also talk about personalized cancer screening and management recommendations and next steps. So for those with a positive result in a breast cancer gene, a Wisdom breast health specialist, most likely Kathy, would reach out and help navigate some of the next steps as well. But we at Color have done kind of remote nationwide genetic counseling for quite some time and have a pretty extensive database of resources and kind of transitions to care that we can provide as well, especially for other non-breast cancer genes. So we really do try to help support you in finding the next care steps and specialists and support resources you may need. And then you always have the ability to schedule another genetic counseling appointment at any time, or give us a call or send us an email. And we have genetic counselors staffed every weekday to be able to answer those questions for you.
And just out of curiosity, that the folks that you have who are doing the genetic counseling will know that they're part of Wisdom, so know to also coordinate with us. I want to make sure that we probably need a meeting to make sure that we're maximizing our collaborating or our integration, because I think that serves both organizations well.
Yes, yes, we met last week and went through a lot of those scenarios, but we will definitely know on our side if you are a Wisdom participant and have incorporated some of those personalized next steps into our, for instance, notes that we write after genetic counseling visit that go out to the participant via email, directing them back to Wisdom too.
Great.
So we'll definitely stay in touch on how we can kind of collaborate more, especially as we're talking to participants ourselves. And, you know, when it comes to these genetic results, most results are negative. That means we did not find any risk for hereditary cancer in the genes we looked at in these 29 genes. So, you know, a lot of factors put together. So if we do not find one of these, it does not mean that you have no risk to develop cancer. You still have a risk, unfortunately, being a human being, to develop any sort of cancer because of those other non-genetic risk factors that come into play. And so it's still really important, regardless of your negative genetic results, that you follow the screening plans from your wisdom team, from your healthcare providers, to get the care you need. But a small percentage of people will have a pathogenic or likely pathogenic, an actionable finding on this test related to one or more genes. Again, having this risk factor does not mean that you have cancer now or that you definitely will develop cancer, but it is something that you and your healthcare team can utilize to enact additional cancer care and treatment and screening. And so again, if you have a actionable result in a breast cancer gene, we will direct participants back to Wisdom too for extra guidance there. And then this is just a demo of what it looks like to view your results. So when you go back to your dashboard and your results are ready, there are some simple videos and friendly resources reminding you of what we test for, what we look at. There then will load your results. Hopefully it doesn't take this long for you. There we go. So then your web results will show up on your dashboard. And there is kind of an overview tab of your actual result. And then there are 5 different tabs that you can click at the top. One includes health impacts, and you can toggle between both female and male cancer risks associated with each gene or each result. There are also references to how we came about to get those risk information that you can view. Under screening guidelines, there are, you can kind of click on each drop-down section to view each cancer type's screening and prevention recommendations. There are also some online tools like how to share results with your other healthcare providers by providing their information there, and we'll send a secure fax over to your healthcare provider with your results. There are some sample letters that you can copy and paste to relatives. A lot of people like to utilize that in a text message or email or Facebook Messenger message. And then there's also a way to enroll family members in Color's family testing program, though they may be good candidates for Wisdom as well. So we'd definitely check in there. And then there's also, under that next steps, a lot of support resources that we link to. You may be familiar with FORCE, as Sue came and talked at one of the forums, but there are also lots of other websites and support groups relevant depending on the gene. And then there's some more scientific information under details, as well as ways to download your report, view your genetic counseling notes, things like that. What other genes were tested and what those might be related to and lots of other frequently asked questions that a lot of individuals like to view in case they don't know what to ask in a genetic counseling session. You can always go to those to find some more information. All right. And data privacy, I know this is something that is really at the forefront of a lot of people's minds. Color is a clinical grade lab, and that means that all of our information that we collect and have is covered under HIPAA and other privacy laws. So what do we do with your genetic information? We produce clinically actionable results first and foremost. And then there are 2 options that you have the ability to say yes or no to when you are creating your account. So one is if Color can use your de-identified data. That means we don't attach your name or any identifiers to your data, but to conduct studies like the study I showed with over 29,000 participants came from people that said yes to that to kind of improve our scientific knowledge. So if you say yes to that, we can use that de-identified data to understand more. And then there's also public health databases. When it comes to genetic information, it's very helpful to know what other labs, clinical grade labs, are finding as well, so that we can further scientific and genetic knowledge. And so if you consent to that, we can use any genetic findings that, again, are not tied to your name or any identifiable information for more public databases like ClinVar. But you can say no to those, and in those cases, we would not use your information in that way. We would only use it to provide actionable results. How can you control your information? You, again, choose whether or not you want to participate in that de-identified data and research. You can also choose to have your sample stored by color in case there are future updates or testing options, but you can also choose to have us destroy your sample. And then you get to control who you share your results with outside of the wisdom study. So there are, if you have additional healthcare providers, if you have a primary care doctor or an OBGYN or another specialist that you want to share those results with, you have the choice to share those or not.
And Kelly, sorry to interrupt, just a quick note on the sample storage. So with wisdom, we actually, any leftover samples get sent to our biorepository for the study. So, and that's something that's part of our protocol as well. So that's, it stays with color just for validation, a validation time point to make sure the results get through, and then they get sent over to our central biorepository. So just a slightly different workflow.
Great.
Yeah.
Thanks for clarifying. And then how do we protect your information? We do not share your information without your consent. And we have built infrastructure that has bank level security with your privacy in mind. So you'll see when you kind of log in and out of your Color account that there are multiple validation ways to make sure you are viewing your own online portal. So
Any thoughts from anyone in the community or any concerns about these changes? Or what would be helpful if we upload a little video to give people instructions? What are the key messages you want us to make sure that we include?
There are a couple questions in the chat that I think can be answered by the next couple of slides. So I'm going to have Kathy go through those, and then we can see what other questions remain. But yes, please share. Think of your feedback if there's something that you see as missing or that you think would be helpful in this process that was just described. Kathy will go through a couple other details on the wisdom end of who can do this updated test and how the results get back to.
Yes. Okay. So this hopefully will help answer some of those burning questions that came through in the chat about if you've already done testing, how do you get this testing? So just to give some highlights, the results will be communicated for those who are doing the larger style panel that covers 29 genes. Results will be shared through both the Wisdom study portal and the Color portal. And there will, if you test negative for any known hereditary risk factors in any of those 29 genes, there will not be active outreach for the genetic testing regarding your results for that negative from either Color or the Wisdom study team. The Wisdom team has other outreach and other education and tools that we'll be using, but you're also empowered to be able to reach out. If there is a mutation identified in any of the non-breast cancer genes that's tested as part of the larger 2019 panel, Color Health's genetics team will reach out to share those results via consultation. And our hope is that by having that larger panel of genes beyond just breast cancer, that we can empower all of our participants to have more information that is important for your screening decisions. And if there's a mutation in a breast cancer focused gene, then you get both contacts. So Color Health will reach out to share results via consultation. And then you'll also have contact from the Wisdom Study team to provide additional context and information, some more personalized risk assessment as part of that larger low pass whole genome risk assessment and a SNP assessment that we do to try and consider non-hereditary factors too. And for those who are already participants who have been so graciously participating for any part of this last 5 years, those who are in Wisdom 1.0, who were consented prior to March of 2023, once you complete the 5 years in the study, you will be invited to continue your participation over the next 5 years as part of this next version of the Wisdom Study. And at that time, you'll receive the updated test. That timing will vary for each participant based off of when you reach the 5-year time period of your participation. So that's why we wanted to save some of those questions you all had for now, since it will be a little bit unique to each of you. And then for those who are currently in Wisdom 2.0, who were consented at different times, if you have completed your color test, currently you will not receive another test kit. If you have already received a color kit but have not completed the test, you are currently part of the group that will be receiving the 9-gene panel. And if you have recently signed up for the Wisdom Study but have not yet received your color kit, then moving forward as part of that October launch, you will be receiving the expanded hereditary cancer panel for the 2019. So the answer will be a little bit different depending on when you enrolled and the timing of that consent.
And I guess one other scenario that's not in here is if you sign up for now moving forward, you'll get the 29-gene panel as well. There's a little bit of nuance to this as the Wisdom 1.0 follow-up time period. We may shorten that 5 years. We'll see. It's a little bit of a negotiation with our statistical team as to when we can let people move over to the new version of the study. So we'll keep everyone posted as soon as we have, if the timelines do change, but this is where they are at this point in time. If you are unsure, if you're in the study and unsure sort of where you fall, please feel free to reach out to us and we can kind of look up your information and see where you know, if you might be eligible to take the new test anytime soon, or if you haven't yet enrolled, then you'll be able to get the new test moving forward. So happy to answer any timing questions for folks as well. Let's see if there are more questions in the chat. Let me go back. So one of the questions was around connecting back to local providers. And I think the specific question was about VA providers or in the VA healthcare system. But I think the answer is relatively consistent across all providers. Kelly and Kathy, correct me if I'm wrong, that as part of the navigation after receiving a positive result, part of those questions will ask, you know, do you have a regular healthcare provider or facility that you go to? And that would elucidate a potential facility and help finding a local genetics or high-risk clinic for high-risk cancer. Is that correct?
Yes, that's correct. So if someone does have a color genetic counseling appointment with us, we generally do talk about in our session where they receive care normally, and so that may come up if they are a VA patient or a patient in another type of healthcare provider organization, or they see a regular provider in their area. And so we get a sense of kind of, how to help them navigate that care. And we do have, as I mentioned, resources and database across the nation of kind of helping to find the right individuals, the right care protocols, especially at the VA, with our other research programs through the NIH that we see a lot of VA patients through. So, that's a great way to letting us help you as a participant, is to let us know where you're getting care, and we can help navigate that as much as possible too.
And then I see a question from Melissa about, if you've already had testing, is it worth joining if some of the genes that you've been tested for are already in, or you've already been tested? And the answer that I think our team would give is yes. In addition to those pathologic mutations, we're also looking at those smaller changes in the DNA, which is not something that's provided back in standard clinical care. And so it can help to create a more comprehensive picture of your genetic risk, so we can evaluate what your polygenic risk is in addition to those genetic mutations. So I think it's helpful not only for you, but also for the scientific evidence generation that we're going after for the wisdom study, to try and understand the larger genetic landscape.
I see there's a question about whether the color test can identify cell-free cancer DNA, and we don't do that. That's a completely different test. And we're looking at, the genes that you inherit, not whether or not there's the presence of a cancer, which is a different kind of test. There's a bunch of people trying to develop these kinds of tests. I don't think any of them are ready for the prime time. I certainly wouldn't use them as a screen. Some of them are being used for follow-up once you've had a cancer. Those are closer to being useful, and we're looking at it in trials like the I-SPY trial to see if they add value, and trying to predict who's already achieved a complete response or the best kind of response. So anyway, and then there was another question about, we're trying to recruit 100,000 women for wisdom, at least.
There's another question about how the new genetic testing is related to the original goal of the study to determine how often to have a mammogram.
It's, the same thing. It's just that we're updating the genetic testing as it, we've always said that we would continue to update the tools that we use, because we didn't want the study to be out of date by the time it was finished. So whenever there's an improvement, we added it. So we kept adding single nucleotide polymorphisms, the SNPs, or so-called the things that make up the polymany genes risk, the PRS score. And because it went from 7 to 70 something to 330, it's, clearly more and more is being used, and we have, the ability to comprehensively test has changed. So that's why we're doing the low pass whole genome, so we have access to millions of SNPs, and we can get at most of the things that might be coming out from other groups. And importantly, we also want to be able to tailor these to ethnicity or race. There's a new SNP profile that we think predicts risk in African American women. There's one in Latino women. There's one really for Caucasian women, because that's where a lot of the research has been done. And there's, some also in Asian American women as well. So that's another, we have the ability to look at ancestry and sort of really try and tailor or right size the polygenic risk score to who you actually are genetically, so to speak. And that the goal there is just trying to optimize that information for you. If you've been on the trial for 6 years, you will get invited to take a new color test, yes.
Hopefully, the first of the new year. We're working on system changes both on our side and color side to make sure we're not overwriting past information and make sure it's a seamless experience on both ends. So yes, hopefully in the winter 2025, in just a few months, we'll be able to start re-inviting people. The other question was why 5 years? So as part of the study, we had wanted to follow people for 5 years on a particular screening arm. And that will help us to answer our primary aims of the study to see if personalized screening is as safe and effective as standard annual mammography. So we need to keep those sort of study groups distinct for the follow-up period. That said, I think there may be an opportunity to move people into the next part of the study, Wisdom 2.0, ahead of that. We are under negotiation with our statistician, as I mentioned, just making sure that we have the most scientific rigor and protocol around our data collection for follow-up so that we first and foremost are able to answer our original study questions.
And we absolutely partner with advocates. And if you have a health fair or education program that you would like us to participate in, please let us know. We'll do our best to send someone if we can.
Yeah. And then I think there's a question about summing this up with key takeaways for non-experts. Anyone want to take a stab? I can take a stab. Summing this up for non-experts with key takeaways.
Yeah. So new way of doing our genetic testing. We're hoping that this will help us waste fewer tests and make people recognize and claim their tests, and so they take some ownership of it. We've expanded our ability to do the testing. We have decided that it's okay to do the full array of testing. It's clear that it's a benefit to find people early on who have inherited mutations in breast cancer, and that really goes for the things we know about. There's a few genes that are very clear risk factors for colon cancer, for an additional couple for ovarian cancer. These are things that we think are useful for people to know. We're expanding our pool of counselors through Color Genomics, our partners here, and we are going to do our best to minimize the number of things that we ask you so we don't annoy you. And you will feel like we are your favorite partner and trusted provider of health information. And we obviously will reach out to you if you have a mutation. Both the Color team will reach out as well as the Wisdom team. We will also reach out to you if we think you have increased risk because of polygenic risk or our other risk algorithms, and do risk reduction counseling, ways in which you can reduce your risk, because prevention beats screening 7 days a week. And we're excited to embark on this new phase of Wisdom, and happy to get any feedback about how this works for people and how we can make it as clear and as simple as possible for everybody. And we, of course, encourage you to share your information about your genetics and your risk with your primary care providers, both to our Wisdom counselors and also from your color team, so you can print that out. Your physicians do better taking care of you if they have the maximum information about you.
There was another question about how to sign up. So our Wisdom website, thewisdomstudy.org, is where people can learn more about the study and log in and register. And from there, you'll create your Wisdom account, fill out some surveys. You can choose whether you want to be in the personalized arm or the annual arm. The personalized arm is what you want to choose if you would like the genetic testing and the comprehensive risk assessment. So make sure that you choose the personalized arm if that's what you're hoping for. And then once we're ready to have you do the color test is when you'll go through the process that Kelly described on today's call. So you'll go and claim your kit. It'll get mailed to you. You spit in the tube, you mail it back, and then everything comes back. All the information comes back to both your color portal and your wisdom portal as well. So, yeah, and just to summarize too, I mean, this next step is really part of our overarching plan and goal to continuously improve the way that we assess someone's individual risk. And when we first started this study back in 2016, we knew there a lot of this information was not available to us. Genetic testing for everyone was brand new. People were questioning, is this the right way to go about things? And so as the science has evolved, as the field has evolved, as it's become more and more common to do genetic testing as part of the risk assessment process, we're really hoping to make sure that we're continuously updating our approach and what we're testing for. And by transitioning to this enhanced test, we're able to sort of open up the doors for future analyses if more evidence comes forward, where we can look at other parts of the SNPs and create new polygenic risk scores without you having to do another test. So again, trying to be as adaptive and nimble as possible based on the evidence that's coming out. So yeah, so thank you so much, everyone. We really appreciate you being here today. Big thank you to Kelly and to Kathy. Thank you for joining us and for providing your expertise and insight into not only the process and the workflow, but the science behind the genetic components of risk assessment. We will be having our next community forum in November. I believe it's the 25th is the last Monday of the month, right before Thanksgiving. The topic is TBD. Fill out that survey that's in the chat and we can make sure that we incorporate your feedback in terms of what next topics we should put on the calendar. We do have a few coming up around menopause. We've had such a great response from a talk we gave last month at the Menopause Society. So there's a lot of interest and new connections we have with menopause experts. So
maybe we should do a summary from Rise Up.
Oh yeah, that would be great. Yeah, and that's a great. I have the Rise Up slide real quick. This way.
It's
Hold on.
it's a good topic.
Yeah, the Rise Up conference, which hopefully you can see, is this weekend, November 1st through 3rd in San Francisco at the Hotel Nico. We can do a summary for those who are not in attendance. And if there are people, I know many of our advocates will be there. It'd be great to have the advocates report back into this group as well from a patient advocate perspective as well. So yes. Excellent. Well, thank you again, Kathy. Thank you, Kelly. Thank you so much. We're so fortunate to have such a great partnership with Color Health and look forward to continuing to expand what we can do to help assess someone's risk and provide personalized screening and prevention recommendations. All right. Have a good evening, everyone. Thanks so much.
Thanks, everyone.